The honourable member for Halifax Citadel Sable Island.
Mr. Speaker, my question is for the Minister of Health and Wellness. Gender-affirming care is life-saving care. The previous government's approach forced people to bring forward human rights challenges in order to have procedures covered by MSI. This approach is not aligned with the World Professional Association for Transgender Health. There are international standards for gender-affirming care, and we should be meeting them. Mr. Speaker, will the Minister commit to expanding MSI coverage for gender-affirming care?
The Honourable Minister of Mental Health and Addictions.
Thank you, Mr. Speaker, and thank the member for the question. I've already had a thorough briefing on gender-affirming care, and we've actually already met with a couple of stakeholders in this regard. So if the member wanted to talk to me after the session to kind of line up some additional stakeholder requests, I know it's a significant issue in the province, across the province, and I'd be happy to follow up with the member opposite. Thank you, Mr. Speaker.
The honourable member for Halifax Citadel Sable Island.
Mr. Speaker, my question is again to the Minister of Health and Wellness. I'm a bit confused by the deferral to the Minister of Mental Health and Addictions, noting that what we're talking about is a broad range of healthcare issues that should be covered under MSI, and certainly jurisdictions like the Yukon very clearly made this a mandate of the Minister of Health. Another hurdle for people seeking gender-affirming care is access to knowledgeable and nearby health care. Currently, Pride Health at Nova Scotia Health is tasked with improving access to care for 2S LGBTQ+ people, but it is underfunded and only has one navigator position serving the entire province. Mr. Speaker, as a start to this important work, will the Minister of Health and Wellness commit to increasing funding for Pride Health?
The Honourable Minister of Mental Health and Addictions.
Thank you, Mr. Speaker. Just to be clear with the member opposite, a significant component of the gender-affirming care is the psychological evaluation before surgical kind of operations would take place. So we all work under the umbrella of health and wellness, like with my colleague in health and wellness and the seniors long-term care. So it's all coming from the same area essentially, right? So I'd be happy to kind of move this initiative forward if you're willing to have a conversation. Thank you, Mr. Speaker.